Hello everyone, and welcome back to our channel. Do you ever find yourself feeling more winded than you used to? Perhaps climbing a short flight of stairs leaves you needing to pause, or maybe you notice a persistent cough, especially in the morning. You might brush it off thinking, well, I'm just getting older. That's normal. Millions of us, as we get older, experience changes in our bodies, and sometimes it's easy to dismiss new aches, pains, or breathlessness as just part of the aging process. But what if that breathlessness, that cough, or that feeling of fatigue isn't just about getting older? What if it's a sign of something specific that, while common, can significantly impact your quality of life if not understood and managed? Today, we're going to talk about a very common lung condition, especially among older adults, chronic obstructive pulmonary disease, or COPD. It's a big name, but it describes a problem that can slowly creep in, making it harder and harder to do the things you love, or whether that's playing with your grandchildren, working in the garden, or just enjoying a walk around the block. It's not just a minor inconvenience. It can slowly chip away at your independence, leaving you feeling anxious and isolated because simple activities become a struggle. You might think it's unavoidable, but often there are things you can do. In this video, I'm going to break down what COPD is, what causes it, the risk factors you should be aware of, and how it typically progresses. But most importantly, I'll share some key insights, simple things you need to know that can make a real difference in managing this condition and helping you breathe easier. Before we dive in, if you or someone you know is concerned about breathing difficulties, please take a moment to hit the like button right now and subscribe to our channel and ring the notification bell so you don't miss our future health tips. Ready? Let's start with the very basics. 1. What exactly is COPD? So, first things first, what is COPD? Think of your lungs like a pair of balloons, but instead of one big opening, they have lots and lots of tiny branches that end in little air sacs, like tiny bubbles. When you breathe in, these sacs fill with air. When you breathe out, they empty. With COPD, two main things happen. The tubes leading to these air sacs, your airways, can become inflamed and narrowed, making it harder for air to get in and out. And the little air sacs themselves can get damaged and lose their stretchiness, making it hard for them to empty fully when you exhale. Think of it like trying to blow air out of a balloon that's gone a bit saggy. It's just harder. This isn't a sudden thing. It usually develops slowly over years. The main issue is getting air out of your lungs. I remember my friend, Sarah. She just kept saying she felt tired all the time. Climbing the few steps up to her porch felt like running a marathon. We all just thought she was slowing down. It wasn't until she got really sick with a bad cough that her doctor checked her lungs more thoroughly and found out it wasn't just tiredness. It was the early signs of COPD, making it hard for her body to get the oxygen it needed. It was a real eye-opener. This difficulty in getting air out is what leads to that feeling of breathlessness, the coughing, and that chronic fatigue because your body isn't efficiently exchanging oxygen. Now that we know what's happening inside, let's talk about why it happens. 2. The number one cause, smoking. Now, while we're talking about causes, it's crucial to address the biggest factor by far, smoking. Both current and past smoking are the primary culprits behind COPD in most cases. Cigarette smoke is incredibly irritating to the delicate tissues in your lungs and airways. Over time, this irritation causes inflammation, damages those tiny air sacs, and narrows those airways we just talked about. It's like constantly pouring something corrosive down a pipe. Eventually, it causes lasting damage. My grandfather smoked for 50 years. He always had that smoker's cough, which, sadly, he just accepted as normal. As he got older, his breathing became so difficult that he couldn't even walk across the room without gasping for air. He missed family gatherings because he couldn't manage the walk from the car. He deeply regretted not quitting sooner, seeing firsthand how smoking slowly stole his ability to move freely and enjoy simple moments. His story is a powerful reminder of the long-term impact. The damage from smoking is cumulative. Even if you stopped smoking years ago, The damage already done can contribute to developing COPD later in life. But smoking isn't the only thing that puts you at risk. 3. Other risk factors you should know. While smoking is the main driver, other things can increase your risk of developing COPD, especially as you age. One significant factor is long-term exposure to lung irritants. This can include things like secondhand smoke, breathing in the smoke from others. It can also be occupational exposure, working in places with lots of dust, fumes, or chemicals over many years without adequate protection. Think about coal miners, grain farmers, or workers exposed to certain industrial pollutants. Another factor can be severe, repeated respiratory infections, particularly during childhood. In rarer cases, a genetic condition called alpha-1 antitrypsin deficiency can lead to COPD, even in people who have never smoked, although this is less common. I knew a gentleman who worked in a dusty factory for over 30 years. He never smoked, not a single cigarette, but in his retirement, he started having more and more trouble breathing. His doctor eventually diagnosed him with COPD, explaining that the decades of inhaling fine dust particles had slowly damaged his lungs, much like smoking would. It showed me that it's not always just about personal habits. Sometimes our environment plays a big role too. These various exposures can cause the same kind of inflammatory and damaging process in the lungs as cigarette smoke, just maybe at a different pace or with different intensity. So we know what can cause it. How does it typically unfold? 4. How COPD usually progresses. One of the challenging things about COPD is that it often progresses slowly over years. The symptoms might be very mild at first, so mild that you barely notice them, or, as we discussed, you might attribute them to normal aging. You might just feel a little tired, slightly more breathless during activity, or have a cough that comes and goes. Because the lungs have a lot of reserve capacity, you can lose a significant amount of lung function before you start to feel significant symptoms. This slow progression means people often don't get diagnosed until the disease is moderately advanced. As it progresses, the symptoms become more noticeable and more frequent. Shortness of breath might occur with less and less activity. Coughing might become more persistent, and you might produce more mucus. Flare-ups, where symptoms suddenly get much worse due to an infection or other trigger, become more common and can be quite severe, sometimes requiring hospitalization. My aunt started noticing she couldn't keep up with her walking group anymore. Then she found cleaning the house left her breathless. It took her a couple of years of these worsening symptoms before she talked to her doctor about it. By then, her COPD was already affecting her daily life significantly. She often said, "If only I'd mentioned that cough or feeling winded sooner." Her story highlights how easy it is to overlook these gradual changes until they really impact you. Understanding that it's progressive emphasizes the importance of early detection and management to try and slow down this process. If these points are resonating with you, please share your thoughts in the comments below. Have you or a loved one experienced similar gradual changes? 5. Recognizable symptoms in older adults. While the symptoms of COPD are the same regardless of age, they can sometimes be more pronounced or have a greater impact on older adults simply because there might be other health conditions present, or because they might already have some natural age-related changes in lung function. The most common symptoms include shortness of breath. This is often the first symptom noticed during physical activity. As the disease progresses, it can happen even at rest. Chronic cough, often described as the smoker's cough, it can be persistent and may produce mucus sputum that is clear, white, yellow, or greenish. Wheezing, a whistling or squeaky sound when you breathe. Chest tightness, a feeling of pressure in the chest. Lack of energy, feeling tired or fatigued easily. I spoke to an older gentleman named Frank who was always very active. He told me he first noticed something was wrong when he had to stop playing doubles tennis because he just couldn't catch his breath like his partner. Then he started avoiding stairs. He initially thought it was just his heart, but after seeing his doctor, they did a simple breathing test and found out his lungs were the main issue. Recognizing that shortness of breath with activity wasn't just normal for him was the first step toward getting help. These symptoms can sometimes fluctuate from day to day, which might also make them easy to dismiss. So, why is it particularly important for us to be aware of this as we get older? 6. The crucial importance of early diagnosis. Because COPD is progressive and the early symptoms can be subtle, getting an early and accurate diagnosis is incredibly important, especially for older adults. You might have heard people say, oh, it's just old age, but as we've seen, it could be something specific that can be managed. A simple test called spirometry, where you blow into a machine, can measure how much air your lungs can hold and how quickly you can blow air out. This is the key test for diagnosing COPD. Why is early diagnosis so vital? While there's no cure for the lung damage caused by COPD, getting diagnosed early means you can start management strategies sooner. This can include lifestyle changes, medications, and therapies that can help slow down the progression of the disease, reduce symptoms, prevent flare-ups, and improve your ability to stay active and maintain your independence for longer. My friend's mother was diagnosed with moderate COPD about 10 years ago. Because they caught it relatively early, her doctor put her on a management plan that included an inhaler and some breathing exercises. She hasn't had any major flare-ups, and while she has to pace herself, she can still walk around her neighborhood and do her own shopping. Her quality of life is significantly better than it might have been if she had waited years longer for a diagnosis. It really showed me the power of not delaying that conversation with your doctor. Waiting until symptoms are severe limits the ability to manage the disease effectively and can lead to more complications and hospital visits down the line. If you're finding value in this discussion, give us a thumbs up. It helps us know we're creating content that matters to you. 7. The real impact on your daily life. We've touched on this, but it's worth emphasizing. The progression of COPD doesn't just affect your lungs, it affects every part of your life. Difficulty breathing can make simple daily activities like bathing, dressing, or even eating feel exhausting. This loss of energy and increased breathlessness can lead to a significant reduction in physical activity. You might stop going out as much, avoid social events, or rely more on others for tasks you used to do yourself. This can lead to a loss of independence, feelings of frustration, anxiety, and even depression. The fear of becoming breathless can become a barrier to living a full life. Many older adults value their ability to be self-sufficient and participate in family life, and COPD can unfortunately make these things challenging. A gentleman I know, a retired teacher, used to love gardening. It was his passion. As his breathing got worse due to COPD, he had to give it up almost entirely. He missed being outside, working with his hands, seeing things grow. He felt like he'd lost a part of himself. It wasn't just about the physical act of gardening. It was about the joy and purpose it gave him. His experience is a powerful reminder that COPD impacts more than just physical health. It affects emotional well-being and our ability to pursue our passions. Recognizing this impact underscores why it's so important to take proactive steps if you suspect you might have COPD or are at risk. 8. Taking action. It starts with you. The good news is that once COPD is diagnosed, there are many things that can be done to manage it, slow its progression, and improve your quality of life. The first and most crucial step, if you are a smoker, is to quit. This is the single most effective action you can take to protect your lungs from further damage. There are many resources available to help with quitting, and your doctor can provide support and options. Beyond quitting smoking, management often involves medications, usually inhaled ones, that help open airways and reduce inflammation. Pulmonary rehabilitation programs, which include exercise, education, and support, can teach you how to breathe more efficiently and exercise safely to improve your strength and endurance. Avoiding lung irritants like secondhand smoke, pollution, and strong fumes is also important. My neighbor, after his COPD diagnosis, joined a local pulmonary rehab group. At first, he was hesitant, thinking he was too old or too out of shape. But he found it incredibly helpful. He learned specific breathing techniques that reduced his panic when he felt breathless. He started a gentle walking program tailored to his abilities. He told me, "It's not a miracle cure, but it's given me back some control. I feel stronger, and I'm less afraid to do things." His story shows that taking these steps can be truly empowering. These are just some initial ideas, and part 4 will go into a bit more practical detail. The key takeaway here is that you are not helpless in the face of COPD. There are proactive steps you can take. Now let's get a bit more specific about some practical steps you can take and things to avoid. Let's talk about some practical things you can do right now or discuss with your doctor. Firstly, if you smoke, seeking help to quit is paramount. Talk to your doctor about nicotine replacement therapy or medications that can help. Even if you've tried before and failed, try again. It's the best gift you can give your lungs. Secondly, avoid lung irritants as much as possible. Stay away from secondhand smoke. If air quality is poor outside, limit your time outdoors. Be cautious with strong perfumes, cleaning products, and other fumes indoors. Ensure good ventilation in your home. Thirdly, if you are prescribed inhalers, use them exactly as directed. Don't skip doses, even if you're feeling good. Inhalers are designed to manage your symptoms and prevent flare-ups. Make sure you understand how to use them correctly. Sometimes a spacer device can make them easier to use effectively. Gentle, regular exercise, like walking, can significantly improve your breathing and overall strength. Even short periods of walking each day are beneficial. Don't push yourself too hard, especially if you feel breathless. Listen to your body. Pulmonary rehabilitation is excellent because it teaches you safe ways to exercise with a lung condition. Mistakes to avoid include ignoring new or worsening symptoms, not taking your medications regularly, pushing through severe breathlessness instead of resting or using rescue medication if prescribed, not getting recommended vaccinations like flu and pneumonia shots, as these can prevent infections that cause severe flare-ups. Most importantly, always talk to your doctor. They can accurately diagnose your condition, create a personalized management plan, adjust medications, and connect you with resources like pulmonary rehabilitation. Don't rely solely on information online. Professional medical advice is essential for COPD. So let's quickly reiterate the main message here. While COPD is a serious and progressive condition, understanding it and taking proactive steps can dramatically improve your breathing, your energy levels, and your ability to live a full, independent life. The steps we've discussed, especially quitting smoking if applicable, avoiding irritants, using medication correctly, and staying as active as possible, are not complicated, but their impact can be profound. It's easy to fall into the trap of thinking that breathlessness is just a normal, unavoidable part of getting older. But sometimes, that thinking can lead us to ignore signs that could be managed. By not addressing potential COPD symptoms early, you risk allowing the condition to progress unchecked, making it harder to enjoy family outings, maintain your hobbies, or simply move around your own home comfortably. You might miss out on precious moments because you're too tired or too afraid of becoming breathless. I know it can be challenging to think about health issues as we age, and changing habits you've had for years is tough. But I want to empower you. Your age is just a number. What truly matters is your quality of life and your ability to enjoy your years. You have the power to make choices today that can positively impact how you feel and what you can do tomorrow and for years to come. It's never too late to start taking steps to protect your lungs and improve your breathing. Every small step towards better lung health is a victory. You deserve to breathe easier and live as fully as possible. In conclusion, we've explored what COPD is, its main causes like smoking and other irritants, how it progresses slowly over time, and the significant impact it can have on independence and quality of life, especially for older adults. But more importantly, we've highlighted that there are concrete, manageable steps you can take, from quitting smoking and avoiding irritants to working with your doctor on a treatment plan and staying active. It's not just about managing a disease. It's about reclaiming your ability to live life on your terms, to enjoy time with loved ones, and to maintain your cherished independence. Now, I'd love to hear from you. What was the most surprising thing you learned today about COPD? Or perhaps you have a question about managing breathlessness that I didn't cover. Please share your thoughts or questions in the comment section below. Your experience and questions can help others in this community. If you found this video helpful and informative, please give it a thumbs up. It truly helps our channel reach more people who need this information. And if you haven't already, subscribe and hit the notification bell so you don't miss out on future health advice for older adults. Most importantly, if you know someone, a friend, a family member, a neighbor who struggles with breathing, has a persistent cough, or might be at risk of COPD, please share this video with them. This information could be the nudge they need to talk to their doctor and take steps that could profoundly improve their life. Sharing is caring, especially when it comes to health. Thank you so much for watching and for taking the time to learn about this important topic. Wishing you easier breaths, good health, and many happy, active years ahead. Take care, and I look forward to seeing you in our next video.